run through of our agenda is peer. We're going to talk about setting a table, which is really the first step of implementing a directly impacted, or as we like to say, justice peer into your organizational culture. And then we're going to talk about the process of shifting the organizational culture to welcome the directly impacted peer into the organizational culture without perpetrating and causing further harm. And after we unpack all of that, we are definitely going to attempt, and stop me if you need to, I do get wordy sometimes. We're going to attempt to leave time for some questions and answers, because you have questions, we definitely have answers. Next slide, please. Introductions. Go ahead, Chacku.
Let me go first. All right. So yeah,
Yes.
some of you may have already heard in past presentations. I'm Chacku Mathai, he, him, his, and I'm Indian, born in Kuwait. We immigrated to the United States, starting in New York City back in the 70s, and then came upstate to Rochester. A lot of my experiences, especially my lived experiences, mental health and substance use conditions, I think resulted from a lot of experience with xenophobia and racism in our community, and just the challenges of absorbing that tension and the trauma and the assaults and a lot of different experiences that I struggled with, an overall loss of safety, and then getting caught up in a system that also didn't see me or hear me or understand us as a community or as a family. I've had my share of being involved with justice through experiences of arrest or police intervention or being in lockup. The small experiences, and I say that intentionally because there's a whole array of experiences that people have had in the justice involved process. I know my own experience started with helping people and peer support in adolescent residences and in psychiatric institutions, including adolescent residents, where people were often held against their will, and also locked units of children's facilities where I was in, offering peer support, and then moved into rights advocacy as a result of that. A lot of times I noticed our rights being violated and people not being able to exercise them. So helping people really in that process was a beginning of a lot of my emergence into the movement. And I've been at it ever since, and a lot of roles in that process. So let me turn it over to Skip.
Thank you. Thank you. And my name is Skip. My actual name is Helen Skipper, but I definitely prefer to be called Skip. I am directly impacted by multiple systems. What does that mean? I'll start off with the big one. For 25 years, I went in and out of the criminal justice system. Every time I went in, I was homeless. I was addicted to drugs. I was suffering from an unchecked mental illness. I went in that way. I left out that way. Never afforded access to support or treatments. And this lasted for 25 years. And at this point, I always break and say something real cute, like, I know I look like I'm a day over 18. So I'm going to say this now. And if I see anybody crack a smile, we'll meet after this presentation and really unpack that. I see you smiling, Chacku. I'm going to see you afterwards. But these multiple systems help formulate and build who I am today. Today, I am the executive director of the New York City Justice Peer Initiative. When I was released for the last time in 2007, I was introduced to peer support. I first became a certified mental health peer, and I then became duly certified in substance abuse. I have worked in peer support since 2007. I have gone all the way up to being a peer supervisor. But the criminal justice system is what has impacted me. I was led into that system because of my drug addiction, because of the mental illness that was not treated, was not recognized, and there I stayed. So the mental health and the substance abuse all kind of was like formalized and recognized while I was in the criminal justice system. So this is where I'm coming home to, because this is the system that most impacted me. This is the system that I'm passionate about. This is the system that I study This is a system that I lean into. This is a city that I'm determined to transform, because somewhere along the way, there are little skips who are just starting their journey. And I don't want them 25 years later to say, yes, I went through the system for 25 years, like I said. And that's my story. So we're going to jump right into this because
Let
there's a
me,
lot to unpack.
yeah, let me start with some of
Go ahead,
these,
Chacku.
Skip, on
Yes.
just the information you just represented in your own lived experience,
Uh-huh.
something that we really want to make sure everyone understands is really just what Skip said. People are going through the system, and more than half, I mean, and this is just mental health. So if there's, when you add substance use and mental health, and so, half to the majority of people oftentimes are experiencing mental health and substance use conditions, going into jail and prison experiences, not getting any kind of support at all, right? So you can see here, people having prior histories, struggling as a result of their histories and being involved in the system. So 43 ever received a diagnosis of a mental disorder. And then if you add co-occurring to that picture, I mean, so you can just use the same prevalence numbers in terms of the prevalence of co-occurring disorders in the overall set, to understand that there's a number of people that are kind of repeatedly, at least half of that in this population, repeatedly going in and out of the system unsupported. And so is there a role for peer support in all of this? Absolutely. So that's the whole point, is that there's one of the entry points is that, as a result of co-occurring disorders, we see a lot of these issues, whether it's, treatment outcomes not being as good, functional impairments, people, those we're dying earlier than everyone else, higher treatment costs, higher risks for homelessness, repeated incarceration, suicide. And so we want to see treatment happen at the same time in an integrated way for both mental health and substance use conditions. That's not happening in the external, outside of the system, just traditional system alone. We have those same numbers of people being untreated. Right? And by treated, I don't mean just medications. I mean the whole formula of support, whether it's getting support to get back to school, back to work, back to family, get connected to natural supports, to peer supports. We're not seeing that happen for more than half of the people in that situation. So the situation is dire. But the reality is that there's some opportunities and a recognition of those opportunities from the national community. President Biden has made that case and created a national agenda for peer support. So this is the time. And we hope that you all get a chance to really make a difference. And if you're here, you're hoping, just like Skip said, and I'm here to make a difference for those of us who have been justice. All right, Skip, back to you.
Thank you. That was very informative. What is peer support? Some elements of peer support is mutuality. Mutuality means that we share same or similar. Shared understanding, our worldviews. We share some similar worldviews. We build relationships. So everything we do is relationship based. It's definitely recovery based. Because everything I say or do as I'm mentoring you is built on a platform of recovery. It's helping each other with that recovery element. It is strength space. We're not focusing on weaknesses. We're not focusing on anything like that. We're focusing on our strengths. It is person-centered. It is you and I together as a member of humanity, as people. I'm focusing on you and what your needs are, not what the doctors are saying, not what the clinicians are saying. They have no place in this. It is person-centered and it's mutually empowering because we're both getting a lot out of this relationship that we have built. It's advocating for me and you to be uplifted, to live out our dreams, to enter into recovery how we want to enter into it. Again, not because somebody is telling us, but because this is where we want to go. And it's based on empathy. Yes, we share same or similar, but it doesn't mean I'm feeling sorry for you. It's empathy because I see myself where you are. And based on that, this is how we're going to move forward. And the qualities that come with peer support, this is not a helper versus helpee. I am not here and you are not here. We are on the same level and we're doing this together. We are pushing and pulling together, non-judgmental, because we do share same or similar, but not everybody's story is the same. So even if it's not the same, I'm still not judging you, nor are you judging me. We're not judging each other. But one thing up here is we are hope dealers. If there is a part of my story that you can pull from and use that as hope that you too can achieve, then yes, please take it. Please wrap yourself in it. Please lean into it. Please walk with it. It is yours. This is your hope. We build community because of the relationship building. It is shared storytelling. Now, note, shared storytelling is not uplifting what we did out on the street. It's not glorifying, but it's shared storytelling of how we made it through the fire, how we fought that good fight, how we're still standing, and how we are still standing. How did I do it? What steps did I take? What pathway did I take that might be the same pathway you could take? Is building trust and inspiring someone. Best of all, it's mentorship. I'm here to help you. I'm not here to tell you what to do, but I'm here to help you. And in helping you, and in you seeing me and how I move, you're going to pull something from that. It's navigational aid. And a long time ago, when peer support was first devised, we were called escorts. I'm sorry, I'm nobody's escort. But I can be a navigational aid. I can help you get from point A to B. And in doing so, I can walk alongside you step by step. But I'm not escorting anybody. And we're also resourceful. So ask me where the best spot is to receive this and that type of service. More than likely, I know, because one thing we peers know is we know what services we need and where to go get them, because we've probably been traumatized in our past life by services that were unsupportive and didn't quite treat us right. And we remember these things. And we listen, we learn. When I was a peer supervisor, I used to tell my peers, and in this same exact wording, be nosy. When you're walking with someone and you go into an agency, you know, there's always a bulletin board with little flyers and pamphlets laying around. Take a minute, read them, pick them up, put them in your bag. Know what's out there. Know what's in the neighborhoods that you walk around. Know what's available. Read up on these things. Build your toolkit by knowing what's around, because you will need it eventually one day. It might not be today, but you will come across somebody who needs that information. And we don't keep these helpful nuggets to ourselves. We pass them amongst our community. That's how we build community, because you can trust me to give you some helpful information. Next slide. The big question. Go back, Chacku. What is a justice peer? I know everybody wants to know. What is a justice peer? Chacku kind of let the cat out the bag. Now you can go to the next slide, Chacku. What is a justice peer? A justice peer is everything peer, everything I just talked about, but with the added valuable addition of lived experiences in navigating the criminal legal system and landscape. That's what makes us so valuable as we look at transforming the criminal justice system, as we look at decriminalizing behavioral health. Because right now, the criminal justice system is a warehouse for those of us who suffer from behavioral health concerns. We can help navigate that system because not only are we peers using the very tenets of peer support, we've also navigated that criminal justice system. You know, that system where they had that special lingo, and we also have to know that advocacy part of that system. Like if you go into a courtroom, who's sitting to the left, who's sitting to the right? What are they saying? What does it mean? Yeah, we've been there and done that. And that's just an extra added value package that we bring along with peer support into a justice peer. Next slide. Now, that was the gravy. And I gave you the gravy before I gave you the mashed potatoes. Here is the mashed potatoes. What do we mean by setting a table? What is the table? Next slide. When you are preparing to onboard someone who is directly impacted, there is preparation that needs to be had. When you're looking at your organizational culture and you're preparing to do something that you have not done before, you can't just throw open the doors and say, come on in, even though that's how you want to do it. We know because you're so enthusiastic and this is what you want to do. But today we have to be mindful of how we do that, because what we don't want to do is unknowingly continue to foster harm or perpetrate harm. So we want to look at our organizational culture and we want to make sure that we are in a good, perfect space to welcome people who are directly impacted. We want to make sure that we are not unknowingly doing something or saying something that might cause additional harm. In some scenarios that we can look at are language. And an example of that is person first language. What are we calling our participants? And this is a scenario that happens all the time. Case on point, if we're giving service and we're in like a facility, some facilities won't let us, like say we have to call for our participants. A lot of facilities are determined that there are no first names and last names. You must call them by their inmate number. Okay, but how might this potentially impact someone who's directly impacted? Do they really want to sit up and say, yeah, I need to see inmate number A56907? That's not really, you know, it wouldn't really make them feel all that most welcome. So maybe we can shift that a little bit. Yes, the facility says we have to call them by inmate number, but we can slide in their first name and last name and then their inmate number. You know, this is our way of trying to shift the narrative a little bit. There's a culture shift that has to happen. There's a culture shift that has to happen. How do we move from a place of service to the directly impacted to a place of welcome them in as coworkers, as colleagues? How do we do that? How do we navigate that? And this is not something that we're probably doing on purpose. Wait, it comes from a place subconsciously. But we need to pay attention to this as we make that shift, because we don't want to talk to our colleagues and our coworkers like we're giving them service. Like, in other words, we don't want to peer speak our colleagues and our coworkers. This is our coworker. You know, we're not analyzing them. you know, that's her coworker. But sometimes it happens that way. But how do we prevent that? This is things that we need to take a look at. Let's look at something simple like lanyards and keys. Do we wear our IDs clipped to our shirt pocket? Do we wear bunches of keys attached to our belts? I spent 25 years in and out the criminal justice system. I'm sorry. If I am in a room that has a closed door and I'm hearing somebody bounce towards me with keys bouncing off their belt, I am immediately brought back to when I was in a lockdown facility and I heard, and I knew COs was rushing toward my door because all you heard was the jumble of keys. And I don't care that I have been home since 2007. When I hear that sound, that's all my mind goes back to. And today we're in 2023. So from 2007 to 2023 is a very long time. But there are some sounds that you will always kind of refer to a thought or a memory. And that's what I think. But some things we just need to be mindful of as we start setting the table, preparing, are these going to be a hindrance, or are we going to harm, or are we going to make our organization as welcoming as possible? And these are just examples. It doesn't mean that it affects everyone, and it doesn't mean that every organization has these exact examples. I'm just throwing some things out for us to get the creative juices working, and for us to take a look at these little areas and potentially come up with some more areas that could possibly be affected. Next slide. And somebody remind me of time. We need to be trauma informed. And being trauma informed means that we're being non-judgmental. And there's a key phrase about that. People who matter don't judge. We're not going to judge people. It's not about what you did. We're going to respect everyone's worldview, which means everyone has a right to their opinion. We have decided we're going to welcome in people who are directly impacted because that's what we need in our organization. So that means when we're sitting at a table and maybe we're having a case conference and we have a range of opinions sitting at that table, that we're going to realize that that person who is directly impacted has an opinion, and that's why we put them into the organization. And their opinion is valid. And that goes right to the next scenario. It's not what you did. And that's a validation of their expertise. This is why we wanted to hire them, because we needed that expertise. So let's not exclude them the minute they get there or negate them for their opinion that they have. We needed that worldview. That's why we hired them. Next slide, please. HR policy and practices. We definitely have to take a deep dive at that. And some of these things kind of overlap. So we talked about language shift in the organizational policy slide. We definitely should look at language shift in HR policies and practices. We should be looking at regulatory requirements and looking at the changes that we will have to incorporate into our practices depending on what they are. And there will more than likely be some regulatory requirements. We're going to look at DEI, and that's diversity, equity, and inclusion. We need to kind of look at how does this differ with those who are directly impacted? What should we include? We're back to the non-judgmental piece again, and this totally hits there. We're going to be strengths-based because this is the avenue, the pathway that we're building. We're using a person-first culture. Again, the pathway we're building. We're building in the inclusivity factor because we want to include everyone. Back to the trauma-informed, because that is the overall arching atmosphere. We definitely gonna have to take a deep dive into the navigation of background checks and the regulatory required paperwork, because ultimately these things are going to differ, and there's going to be some intentional other work that needs to be incorporated when it comes to HR policy and practices. And I really want to speak about accommodations. When we hear the word accommodations, we somehow think this accommodations is just for someone who might have like a physical handicap or a disability. But when you're looking at the justice impacted population, it also entails making accommodations for court appointments or maybe community supervision appointments. Is this a real deep accommodation? It might be the difference of maybe they need to leave an hour earlier. Maybe they're willing to say, okay, I'll take a half-hour lunch because I need to leave a half hour earlier once a month because I have a community supervision appointment. Like, we need to keep that in the forefront. Because this is some of the stuff that comes along with us being willing to hire those who are directly impacted. And that's an accommodation. We need to be willing to say it's okay. It's okay that you need to leave a half hour earlier, because if someone had a doctor's appointment and needed to make that very same arrangement, we would be okay with that. You know, so it should be no different with someone who's directly impacted. Next slide, please.
Hey, before we move on, can we just stay there for a minute? Do you mind if I jump
Sure.
in a couple of points
Sure.
on that? Because this is so important. I mean, first of all, so thank you so much. You've already presented so much important information. And I want to kind of emphasize in that setting the table process. And so those of us who have been in kind of administration roles and opportunities to lead organizations and setting up systems. I don't know if there are administrators or directors in the room right now, but this is the time to be looking, and I Skip, what I'm hearing you say is that this is the time to look at all of it ahead of time, right? Like this is pre-work. This is work that, you know, so whether
Absolutely.
Organizational culture, like the keys, that's a brainstorming process of all the kinds of ways in which our culture reflects jail and prison culture, or, you know, criminal justice involvement at that level. There are ways in which we might adopt things that we didn't even realize we were adopting. And that's a great example of that. But moving into the background checks navigation, I wanted to emphasize a couple of points, is that sometimes providers don't realize how much latitude they have. There's a process in New York State where people have to go through a justice center background check, and there's information that comes back to the provider about that person's background. And depending on the way that background check goes, there will be either a denial, right, or an approval, or and in between there's some conditions, it's like a not denial, but we're not approving either, right? So in that in-between space, it's important for organizations to develop your own structure of actually how are we going to make decisions about hiring when someone is in that in-between space, all right? Even if somebody's approved, do you have a mechanism that you can disclose to be assured of your own process, and that the person who is trying to be hired actually can hear about? Because that lack of transparency while you're waiting around to find out if you got a job or not, or the worse yet, the back and forth, like, oh, I got a job, oh, now they changed their mind, oh, I thought I had the job and now they fired me because the background check came in. That's a terrible experience. And the way in which you can proactively address that is have all of this information on paper, on a one-pager, or on your website, or on your, be very clear about what is involved in that decision-making process. So if you're going to ask for additional information, for example, if you're going to ask for attestations or any kinds of thing that actually additional references, these are things from an HR perspective you need to have clear processes for. If you don't, not only do you put yourself at risk for violating someone's rights, you put yourself at risk as an organization when you violate someone's rights, right? So, we're making sure from a peer-based perspective that people are aware of their rights in a criminal justice environment. So, for example, certification should not be requiring background checks. All right. So I don't need to get a background check in order to get certified as a peer supporter. That's one of the national standards, actually, that you're going to see being requested comment by the federal government right now. So, and that, by the way, you should get on that. If you don't have that information, we'll send that information out in terms of getting draft comment, because there's only about 7, 8 days left, I think, in order to give comment on these things. But I guess I just don't want to underestimate the planning that this requires. And a lot of times HR offices and HR staff don't have the background. So there's this lack of connectivity between people who are running the peer support program or wanting to set it up and the HR office themselves, right? So that's an educational. You need to really, whether it's bringing in Skip or bringing in other people who are going to help educate your human resources team, or even if it's one person or whatever it is, making sure that they're educated about what's required. So getting back to the accommodations, for example, if you're only a mechanism for getting an accommodation is to require medical documentation of a condition, that's going to that's not going to be enough. That's going to be very unhelpful to someone. Now they're going to have to go back and get more documentation just to get a 1-hour leave to go for a community supervision meeting, and that's not what we're looking for. We're talking about, have a flexibility management process that allows flex time, that allows for, what's the underpinning point of all of this? Do we trust people? And I want to emphasize that. I can't tell you how many times I've come back as a CEO or as a director of a program to a person that is kind of coming at me with a lot of questions about their coworker, their criminal justice involved coworker. All right. And I'm like, you know what? It's really sounding like you don't trust them. And I'd like you to tell me why that is. And it would come out that the person was actually biased by their criminal justice history and their knowledge of it. I was like, well, that is something we have to address. If the culture continues to avoid conversations, tough conversations about bias in that regard, that's the DEI space that Skip was talking about. It's a disservice to this opportunity to actually have a change in culture. This very process changes the culture of the organization. It's an intervention in and of itself. All right, Skip. Sorry if I'm taking too much time.
Not a problem.
Re-emphasize.
Hold on. Not a problem. Definitely. Let's go. Thank you, Chacku, for really digging into that. Let's go into job description development. And how am I on time? Am I good? Y'all know I got to get to talking.
You're doing great.
Okay. Job description development. What are some of the needs that we should have as we're building that? Before we even start building it, we need to have a definitive workflow. Like, we need to know, what is the job? What are the points of the job from point A to Z, from number 1 to number 999? Definitely want to make sure that there are peer values and competencies in the actual job description. We need to know hard skills, which are job-related competencies and abilities. We definitely need to have a robust discussion about part-time versus full-time versus per diem. We need to know what's going on in the rest of the state versus the country as far as what's happening with peer support jobs. And how come most of them are part-time? Why can't they be full-time? Why a lot of people want to do per diem? We need to know about the differences between pay scale versus pay rate. We need to know that people who are directly impacted and people who are peers, we want to have a decent wage, a decent cost of living wage, just like everyone else. we definitely need to understand what is co-optation, importance of non-co-optation. And co-optation is basically, in real short and simple, hiring me under a peer support salary, but giving me job duties and having me do the job of a counselor or a case manager or other things, but not paying me as such. So we don't want to be co-opted. We can do the job of a counselor or a case manager. We can do any job, but pay us like you would a counselor or a case manager. You can definitely hire me as a counselor or a case manager. Just pay me like you would. Don't hire me as a peer and pay me as a peer and then expect me to go out and be a counselor or case manager. That is not fair to me. And unfortunately, it's been a trend, and a trend that we must stop. You also need to figure out on-the-job training. And this directly affects those who are directly impacted. And this is because if you are directly impacted, you spend a large amount of your time incarcerated. There are things you have and there are things you don't have. There are things that people who are not incarcerated had access to that are part of their worldviews that are not part of our worldviews. People who are not incarcerated probably watch their parents get up and go to work every day. And they had kind of like that model in their head, maybe watched it on TV, you know, with those family shows. Maybe we didn't, so maybe we don't know what that is. So when you build your job, you need to figure out like how much of on-the-job training are you willing to do? Because there has to be some mediocre of on-the-job training. We need to figure out what are your needs and what are your nice to haves. Soft skills or personal qualities and traits. How much of those do you need? Or how much of those are nice to haves? Or how much of those are you willing to train on the job? Tech competencies. Tech. That's a 4-letter word, especially when it comes to those who are directly impacted. You have some people coming home now that when they were first incarcerated, we were on the flip phone. Now we have smartphones that are better than a lot of laptops. I just got an iPhone and I hate it. Hate it. And my 16-year-old can work it better than me. Imagine someone who has been incarcerated for 20, 30 years. How can they come home and navigate using a smartphone in a week? And I've been using phones since I came home in 2007, and I still can't navigate this iPhone. You expect people you hire to already know like emails and Outlook and Gmails and literally how to turn on a laptop. Some people who are directly impacted did not have access to that and might not even know that. The digital divide is real, and it's even bigger when it comes to people who are directly impacted. So there will be a learning curve, and that is to be expected. And that goes back to the question about on-the-job training. Documentation, another big thing. Some facilities will release you without any type of documentation. That is birth certificate, social security card, things of that nature. Some might have it, some might not. Some might only have a facility ID card. Something else that's a hurdle to get over. And then once you come home and in the reentry phase, it's actually hard to get those documents because you need a certain amount of points in order to even get a New York State non-driver's license, which is legal ID. But you need a certain amount of points, which we don't have. Professional etiquette. Some of us have never had a job before. And again, that goes back to our worldviews. Some of us did not come from an environment where we watched people go to work, where we sat at a dinner table and heard stories about what happened on the job, how people navigated certain things that happened at the water cooler or while they were sitting at their desk. Some of us didn't come from that type of environment. And we didn't have any type of career counseling. Facilities don't give that type of training. They'd rather put you to work in a mess hall and really learn the ins and outs of how to mop a floor than to give you that type of training, which will help you succeed once you are released. And of course, back to tech is software knowledge. Next slide.
All right, I'm going to jump in again, Skip.
Go ahead.
Before we go, yeah, because this is one of those areas again where I want to, you're saying some important things that if we unpack a little bit further. So let's use the part-time versus full-time versus per diem example, right? Again, this is why this is so important to do this pre. And when we're saying pre, like this isn't something that happens 2 weeks before you hire, all right, and start. This is like a 6 month to 1 year plan minimally, all right, of preparation work. Because when you have a decision to have a part-time person, sometimes that's driven by, well, I don't want to, the organization doesn't want to pay for health insurance. And so they keep the hours under 20 hours. All right. Or from a per diem perspective, they want to have the same skill sets, but not necessarily be able to spend the time on the job for training around these things. So there's a tension between the preparation. So then you have somebody who's per diem or part-time, not getting the same work culture kind of opportunities and training that's actually happening for everyone else, but somehow expected to step in and be in step with everyone else. So that causes rifts within the team. It causes a lot of tension around what's expected of people. And from a professional etiquette perspective, I wanted to address the co-optation point, because a lot of times co-optation is as simple as don't disagree with us. And when there's a person with peer level justice involved experience, they're going to bring perspectives that are very different from everybody on the team. And if perspectives are actually going to be heard, they need to be trusting that they can share something different without being asked to fit in, in some respects, right? Fitting in means being agreeable with everybody in some cultures. So if you're not necessarily if you're conflict averse or disagreement averse, or, by averse meaning not wanting to see it at all, or think playing well with others means they agree with everybody, you know what I mean? They don't give anybody a hard time. That's going to be a problem, because I think we want people to be able to help change the culture even while they're there. It's not that the culture is going to be perfect coming in. That's impossible. But we can prepare it to actually respond to those voices and perspectives, just as some examples. And then what I've learned also around the on-the-job training for us is that, for example, with Peer Bridger, a lot of times we had a lot of things we didn't anticipate, and that's what one of those things that came up was sometimes a person would meet somebody at the gate coming out, but they also had peer support meetings to run the same day. But that person at the gate needed more time to be supported. There needs to be a mechanism to actually deal with those changes in the schedule or the workflow as you described it, because if the workflow includes supporting somebody coming out for the first time on their first day, and helping that person transition on their first day, that needs to be given space, to actually operate within that day. So there's just a lot of things like that that I think, are worth doing, but also making sure you have people with lived experience involved in the planning so they can make sure that process is clear. All right, Skip, thank you.
Not a problem. Jump in whenever you need
Well, I know
to.
that was that, what we, we were gonna, you got it. This is a lot of great stuff here. Keep it up. Yeah.
And then we come to the onboarding training regimen, which is also one of my personal favorites. Because here's the thing, somewhere along the line, I guess the expectation has been lessened when it comes to those who are directly impacted. And I'm one of the ones that like stand up and stomp my feet up and down and jump up and down and raise my hand and say, why? Why do people feel we don't want professional development? We don't have career ladder expectations. We're just like everyone else. We want to move up. We want to move ahead, So you want to build in capacity building. And here is where I come in as technical assistants, as consulting work that I do, is how do you do capacity building? What is that? How do you build capacity? Well, basically, it's knowing what you need and then doing it in like a visionary process. And then looking ahead a year or so down the line and knowing what you will need down there. And building that into an onboarding and training regimen. And moving from there, it's professional development. Because as I said, everybody wants to move ahead. Tell me how I'm doing, and then teach me how to do better. Put some pathways in my purview that will show me how I can do better. Help me build up my toolbox. That's what professional development is. Social workers have professional development. Everybody has professional development. Every year you have to go take another couple of courses of continuing education. You have to prove that you've taken them. Career ladder expectations. When Medicaid redesign happened and everybody wanted to hire a peer, this is where we first built the New York City Peer Workforce Coalition, because we didn't have a workforce. And now everybody's hiring peers, but nobody took a look at 5 years down the line. I don't want to be hired as a peer and then 5 years later, I'm still a peer. Like there's nowhere for me to move. I can't move up. I can't move sideways. Like I'm still a peer. When I worked with the New York City Criminal Justice Agency and they said, come in and build a team of peers working in the criminal justice space, I started as a coordinator and I had a senior up under me. And we built our team. We hired like 4 peer specialists. But as I moved up, the team moved up. My last position there, I was a senior manager of peer services. Under me, I had a manager of peer services. Under him was 2 peer coordinators. And under the peer coordinators was 2 teams of peers at 5 peers each team. And when I met with the whole team, I let them know my position is here for you to take. Please come and take it from me because I have opened the door. I have built this position. This is a position that you can be promoted into. Why? Because all you need is that capacity building and professional development. We want career ladder expectations. Please remember to build this into your onboarding and training regimen. Please remember to build to professional development, and please remember to be a visionary and look 5, 2, 3, 4, 5 years down the line and look at what promotional opportunities that you can build into these positions. Suppose you're just hiring 2 or 3 line staff as peers. 2 or 3 years, those peers can be seniors. They can be managers. They can be coordinators. They can supervise more line staff. But we have to see it to believe it, as Amanda Gorman said. You gotta see it to believe it, but you have to see it first. And then you also want to think about upskilling requirements. Today, I do believe in being duly certified, because today behavioral health encompasses both mental health and substance abuse. So I believe in being duly certified and having both skills under your tool belt to be the most beneficial. you want to again look at those expectations. You want to again look at those hard skills, which are job-related competencies and abilities. And you want to look at the soft skills, and you want to think about how to build upon those. You want to think about what you want coming in the door, and how can you build upon them through your onboarding and training regimen. Because there's always more training. I am a lifelong learner. And I will never ask any of my team to take a training that I haven't already taken. We must always want to add additional tools in our toolbox. Next slide, please. Peer supervision. I am going to tread very lightly with this because my colleagues are actually doing a whole separate training on peer supervision that I advise everybody to lean into, because this is one of my mentors that is doing this. And I could never give you as much information about peer supervision as he could. I have learned from him, but I want to definitely second the idea that you should build in a mechanism for peer supervision. And part of that is thinking about what is your expectation for supervision. You also want to think about how supervision will be offered. What is the timing? Will it be weekly? Will it be every other week? You want to think about how supervisors can be accessed. Is there an open door policy? And you want to think about the framework for the authentic discussion of barriers and triggers, of which there will be, because you're hiring directly impacted people and you're asking them literally to go back into the spaces that impacted them. Hence the need for peer supervision. And that's all I'm going to say. Watch the other training about peer supervision. That is my public service announcement for that training. Next slide.
That's the last slide, Skip.
Oh, I did good.
You did
I
great.
did good. Thank
So
you.
I think where we are now is in an opportunity to really, hear from people about what their objectives are, what you came for, what you're looking for, and any questions or comments. Yeah. Anybody want to start? Bill, were you trying to say something? I saw your mic come on.
Yeah, but I'll wait till somebody else and then I'll follow.
All right. All right.
I appreciate that. Thank you, Chuck.
Anyone want to raise your hand or? Yeah, go ahead, Matthew.
Yeah.
Yeah, so I was just gonna say, I have a lengthy history with criminal justice. Let's just say that, and so I got my life together, and I have almost 6 years since the last time I've been in jail. So thank you, but so I got interested in giving back to the community, and I just wanted to say about you mentioned accommodations. So when I applied for this job, like I thought it was a stretch. Like there was no way they're gonna hire me for this job. And so I put in the application, they gave me a call. I'm like, all right, I'll go to the interview, but there's no way they're gonna give me this job. And then the lady that I was talking to, which she's my boss now, but she was like, I don't know why it's taking so long. We're going to do this. And then the next day she's like, I'm going to get a hold of my boss. We're going to figure this out. And I can't tell you how many accommodations they made to get me in here. And I don't know if it's every work culture, but I could say like they made me feel 100% included. Like I'm included in all the staff meetings. They ask for my opinion with everybody I work for. So, I can't speak for every place, but I know the place that I work for, I love it. I love the culture they set for me. They made me feel just like I'm everybody else here. You know what I mean?
Thank you. Thank you, Matthew, for that. I can't begin to tell you how important that is. I myself, like I said, I've been working as a peer since 2007, and I've had 2 occasions to be the first peer at 2 very different agencies. The first place, I was just further traumatized. I was by myself in a different county, really, from my supervisor, by myself, in a supportive housing place with participants, no supervision, no nothing. And my supervisor never came around and saw me, and it was just a mess. The second agency, I was the very first peer, and what they did was so far above and beyond. They realized that I needed adequate supervision. They contracted with an outside peer supervisor to come in and give me peer supervision. And it was just such a beautiful experience knowing that that agency said, look, we don't have it here, but we're willing to bring it in just for you, just for that hour a week. And it was only an hour a week, but it made a world of difference that I could say. And I had a clinical supervisor there who also was very into what I said and very validating, but it just made a world of difference to have that peer supervision as well. You know, and this is something we really should start leaning into as we bring in people who are directly impacted. Like, we're willing to go that extra mile and go back into these places and spaces that traumatized us. And if we're willing to do that, please return the favor and be willing to help support us, in the eventuality that we might be triggered. In the eventuality, it might happen, it might not. You never know, but let's err on the side of caution. Thank you for that. Any more hands?
Let me get a couple more people in here. So we got Nydia.
Yes.
Yeah, good to
Let me
see you,
put my
Nydia.
hand up.
Hi, Chacku, how are you?
And then we'll get Bill back in. Yeah, go ahead.
Thank you.
One of the things that completely grabbed me was the language part, the language piece, right? I work with individuals now that are directly impacted by the criminal justice system, directly impacted. But the piece that we don't have in this area, well, they have me, is that the language barrier, right? The language barrier in my area. I'm upstate New York. So I'm in Amsterdam. We have a large population of Hispanics. And the traumatization keeps going and going. They get out of prison or jail, they get to a facility or an outpatient clinic and nobody can talk to them. And then, we want to send them to treatment and nobody can talk to them. And it's constant. And I've heard doctors and nurses say, well, how was he in jail and he doesn't speak English? You don't need to speak any language to get incarcerated, because they're barely going to talk to you anyway. That's number one. And number two, it's that piece that, like, this is my fight, right? This is my claim to fame. I'm bilingual. So I am able to push back on a lot of things. Just now, I was doing a Zoom MAT appointment. And out of nowhere, I was looking at the computer. Now I'm computer literate. I've learned a lot, but I know I got a lot way to go. And I pushed the caption, right? Show captions. So I pushed that, right? And the doctor was talking to us. Nothing that she said translated properly to Spanish. Nothing. And when I spoke to her and what she received from me in English that was supposed to in Spanish was supposed to translate in English, she goes, what are you saying? That's gibberish. But in so many modalities, they want to use laptops, phone lines, and believe that this is something that's helping, and it's not. So I was so grateful when I saw the first thing on your slide that said language. I was like, somebody heard me. Somebody heard me.
Yeah.
It's don't, I can't even, I can't even. And that's what, and you know, and that's one of the things that I'm fighting for in my area in Montgomery County is that not just jails, prisons, but DSS, housing, you know, all these modalities that people have to interact with, that no one speaks their language. And then when they don't show up for appointments, they're further penalized.
This is great, Nydia. We want to see
you.
language standards, and so there is something called the culturally and linguistically appropriate standards, class standards that are required. You know, there's a whole set of them, and one of the things that we didn't talk about is, you know, utilizing some of those things about a way that actually helps integrate peer support into your organization. That's another example of that priority. All right, Bill, you wanted to say something, and then, you know, we'll.
Oh, thank you. Yeah, you know, it's funny because my sister there, Nydia, we just talked to each other earlier today. You know, when you know, when, depending on who the audience is, when you talk about language, you're talking about recovery-friendly language, you know, or when you're talking to someone else, you're talking about the lack of language on the part of, you know, to be able to communicate with other people's who speak other languages, you know, it hits us a little differently. But anyway, there's a couple of things I wanted to bring up that Skip brought up. And again, I think the problem is that because there's such a short time and we use bullet points, that sometimes we'll say things or it will come across without the full meaning. Now, a lot of us who are in the position of either administrators or have been in the field a long time, we understand what was meant. But again, I'm not quite sure who the audience is, and I just wanted to clarify a couple of things. So for example, earlier on, I think it was the same slide where you had mutuality. I think you said something along the lines, and I can't remember what it is, that there are certain things where the doctor and the clinician have no place. And I think, you know, on the one hand, when you hear that, you go, whoa, that's not right. We're a team effort here. You know, the clinician is part of the team, the counselor, the doctors, and all the rest. So I just wanted to point that out, that I think that's what you meant. I think what you meant, I don't mean to be an assumption, but this idea about, you know, treating people as a resource and they come first, person-centered, so we need to listen to and address the person who is coming in for services, as opposed to having somebody from the outside trying to dictate what that person's recovery should be. That's what I took out of it, but that's what I heard, is like they didn't have any place. The other thing that comes up often in webinars like this is co-optation. And so I think I may have mentioned this before, forgive me, where co-optation originally was a great idea because, or the movement or the awareness, because we were being taken advantage of, as you say, we were being mistreated, we were being asked to do things, blah, blah, blah. I'd like to think that we've come a long way because of the efforts of Skip and you know, Chacku, thank you. I was going to say Chacku, and you know, for New York and places like that, we've really advocated for ourselves. So what I'm worried about now, though, is the same thing with unions. Unions were great, but now they're too powerful, so that you'll have police do whatever they want, and the union's going to protect them. Teachers will do whatever they want, and the unions will protect them. And so what I'm saying is that we also need to be careful in our field that, you know, as long as we make sure that the SERPA is being protected and entitled to, you know, respect and all the rest of that stuff, that's fine. For example, when I heard you say, and I could be wrong, where, you know, co-optation, they're asking me to do a job, you know, a clinical job or whatever, and I says, and there's a discrepancy in pay, but if you pay me, I'll do it. Well, no, we're not going to do it because we're not qualified to do it. I don't care how much they pay me, right? We're not qualified to do it. What we need to do is say, look, that's not in my lane. I'm not supposed to be doing that, you know, that type of thing. So again, I think it was just, you know, it's just one of those things where it could be misinterpreted. I think that's what you meant, you know, that we need to be able to stay in our lanes. We need to be able to be treated as everyone else. And that's the last thing I'll end with, that when we say we need to be treated like everybody else, right? Which is true. What I'm seeing in the field now, as a supervisor, as a consultant, as a trainer, is a lot of places are creating cultures, as you say, that in some cases are overcompensating, and where the peer is no longer being treated like everybody else. They're being treated special, right? And so we need to find that balance, because we need to be careful. We don't want to alienate everybody else. As you said, and as we all say, we want to be treated the same. Everybody should be treated the same, but we don't want people being treated more special than somebody else, because then you have that infighting. Why is that person being treated that way? I think you brought it up, like, why is that person allowed to have professional development and we're not, right? But on the other hand, why is that peer allowed to come in late all the time? Instead of coming in at 10 minutes break, they come, they take their 20-minute break and things like that. So we need to really be careful about that, speaking as a supervisor. But listen, I love what you
No,
guys are
thank
doing.
you. Thank you very much. Let's see, Helen, I know, let's see, there was somebody else that had a hand up. I might have.
Yeah. Yeah, I just like to speak to, yeah, Bill,
I
thank you
want to
for
respond
that.
as well.
Yeah, Skip.
Yeah, thank you for that. But let me just clarify. So I have nothing against clinicians. I'm not one, and that's by choice. It's not that I couldn't be one. There are plenty of peers who have crossed over and become clinicians or social workers or vice versa. But when I said about being a case manager or counselor, we don't have to be clinical case managers or counselors if you want to think about that. But there are plenty of non-clinical case managers or counselors. And that's really what I meant. Not so much as, say, like a case act or something like that, because
Yeah, that's what I thought. But
yeah, that's
wasn't-
clinical. Yeah, that's clinical. But there are there's in my other agency, there was what they considered bachelor's level case managers who were not clinical, but simply had to have like a bachelor's,
So
yeah,
I appreciate
But-
that, Skip. So there's a couple of
Definitely.
points that I want to add though.
Yeah.
And so I appreciate.
ahead, Chacku.
Bill, this is this, I think the second training where you've spoken up about something like this, and I want
Uh-oh.
to, right? So, no, it's not an uh-oh, it's actually a good thing. I mean, it's because there's an issue where in the management of difference, right, that a lot of times people will default to a low standard of treating everybody the same. And then they think from an equal employment opportunity perspective that that's the actual standard, that actually equals equity. When in fact it doesn't. That's saying treating everybody the same means we all have the same qualities, we all have the same needs, we all have the same capacities, we all have the same, and that employment should be colorblind, should be blind to disability, should be, these kinds of things. From an equity perspective, from a management perspective, and I want to emphasize this has been probably 30 years in the making, is that there are ways in which difference can be finally seen as a strength, right? And the capacity that everyone has on a team, as you said very well, that, from an interdisciplinary team perspective, we want to see those strengths, whether it's a different lane or a different practice or a different discipline of training or a different worldview, that those have a seat, not only a seat at the table, but a voice and a capacity to actually contribute. So sometimes from a very ableist kind of perspective, we want everybody to, for example, say hi in the halls. Let me just kind of put it that way. Or we want everybody to be on time. It is a fair understanding. But at the same time, if somebody has appointments, I've had people complain about somebody getting accommodations when it's none of their business. They get their job done. They accomplish the work, but they don't feel like they're being treated the same. So we just need to be aware of the microaggressions that can occur on the other side of that when people do actually get treated differently because they have a right to be.
Yeah, I like the way you put that. I'm thinking in terms of opportunity, but transparency has a lot to do with it as well.
Right, exactly. Yeah.
Yeah.
So
I agree.
the more transparent we can be about those things, the better.
Yeah, absolutely.
Thank
Thank
you
you.
for raising it. Yeah, so it's definitely an appreciation for what you're raising. All right. Anyone else? Okay, well, I want to unpack a couple things that have been important in this process. One of them is a lot of times, I'll get called up, Chacku, you've been justice involved, and I'll say, yeah, kind of. They're like, well, can you come speak at this panel? And I'll say, well, no. And I said, why not? I said, well, I have a lot of other people I think you ought to hear from. I'm not sure why you keep calling me. I keep giving you other people's names who have much longer histories of being in the criminal justice system and are actually better representation of what's needed and can speak to that from a lived experience perspective.
Mhm,
Um,
mhm.
What I've heard a lot of times is that, and I've seen it, I'll see panels in DC, I'll see panels all over the place where people are just saying they're justice involved. But when you really ask them a bit further about their experience, they were like me, maybe in handcuffs once or twice, or in lockup for a day or two, or something like that. And that's fine. I'm not saying, questioning whether that means we haven't been impacted. I've been in front, I've had a number of police involvements that were problematic. So I can speak to that, right? I can speak to those experiences. But we also have to be careful of taking seats from a privilege perspective, because we've had the privilege of being the one to get asked, or somebody knew me or knew that person or do that we're not bringing the people forward who actually have those experiences. And that's why, Skip, for example, you've been so important to us in our community, because you've been able to speak about it as well, be open about it, but, and that's not only courageous in and of itself, but be challenging. I just saw you just, challenge the federal government yesterday. I mean, so like, so and in a wonderful way, in a way that was needed. So I think these are the kinds of things.
Thank you, Chacku.
Welcome. But I just want to emphasize that point. Be aware of the opportunities and why we might, and the biases that might actually limit representation of criminal justice involved people and justice impacted people. All right, let's stop there. Skip, any closing remarks? Or
Yes, yes. My last closing remark, and I just want everyone to be mindful of what I like to call inclusion can often mean exclusion. And I say that with intention. We all have good intentions, and we want to have that semblance of inclusion. But I think we all need to sometimes stop and take a look at, what does inclusion mean? And I will use this personally. I've been invited to some very well put together and nice events where the intention was inclusion. But then I still find myself being excluded, and that's because it wasn't well thought out. There was an event, it was an all-day event. There were speaker panels going on throughout the day, an hour here, an hour there, and then it was a break for lunch. And I was the only directly impacted speaker. And the fact that you wanted a directly impacted speaker at what you were billing to be a mental health summit, great. You are including us. You are giving us a seat at the table. But then in just one quick X, you took that all away when, for the only directly impacted speaker, you gave me a half hour at lunch, where everybody else had an hour throughout the day. For me, you gave me a half hour at lunch when people were trying to choke down the nasty sandwiches, who had got up, to stretch their legs and, get the fresh air, have a smoke, have a bio break. You gave me that half hour. And this was a prestigious event. There were heads of psychiatric facilities. There were judges, DAs. And I took that little half hour and I let them have it. I did, because there's no hair on my tongue. And yes, I can be professional, and I am professional. I am a criminologist. I have scholarship. I am published. I am just as prestigious as you, regardless of my background. But don't include me and think I'm going to sit at the table and not say anything. And then exclude me and think it's going to be okay, because it's not okay. This is why nothing ever happens. You know what I'm saying? So just, and this is not a tap on the back of the hand. This is not a pow pow. This is just an intentional thought. Like we're going to be inclusive. Let's be 100% inclusive, not halfway, not, not inching our way, oh, should I? Let's just jump in. The water's great. Let's just jump in. But I want to thank you all for listening with me, not at me, but with me, with intention. I love that word, intention. It just means so much. And I'm finished.
Thank
And
you.
look, we're giving you back 4 minutes of your day. Ain't
Yeah,
that
let me-
nice?
well, I don't know
Probably
about that. Let
2
me turn it over to, let me turn it over to Carrie and see what she does with it. Yeah, yeah. Go ahead, Carrie. Yeah.
Yes, well, thank you so much. I mean, thank you all who also added your comments, whether in the chat or diving in, live. It's so appreciated. In the chat, I put again, the information about upcoming events, resources to become a peer, but I will also be sending the slides and also related resources. In the meantime, take good care of yourselves, have a good couple of weeks, and I look forward to virtually seeing you all shortly. Thank you.
Thank you, everybody. Bye.
Thank you all. See you, Chacku.
Thanks, everyone.
Good work. Great work.